Good day, everyone. We are now on the next chapter of our lesson entitled Community Health. So, what is community health? Community health is the collective well being of community members. In addition to living in the same neighborhood or region, these populations often share health characteristics, ethnicities, and socioeconomic conditions. So, basically, it, it is only considered as a community health once a particular group of people are living on the same area or geographic location. So why is community health important to public health? So community health programs address disparities by ensuring equitable access to health resources. So in terms of community health, health resources are most importantly being able or easily to be accessed by the people within a community. It must also maintain to be accessible, easy to use, and also will not trigger the financial stability of a particular group or a family. Such disparities include living in an isolated rural area with limited healthcare providers or being unable to afford health insurance. So, community health services are required to be budget friendly, or sometimes it is mostly required by the government as a free medication towards those residences who are not able to pay enough financial support towards a certain health or medicine. So, community health centers often serve as the primary care provider in communities where health equity is limited by socio-economic factors. Next, community health elements. So, what are the different health elements in terms of community service? So, first one is identifying top public health concerns. So, it is where within the specific geographic area, such as environmental and social factors that affect healthy life choices. So, it is always important to consider the geographic location in order for us to easily identify what are the main or the necessities needed by the people around that area. Second is developing an intervention plan. So, developing an intervention plan to address resource gaps in the community, such as establishing community health centers, mobile clinics, and outreach programs. So, within this fact or within this element, it is also related on the first one, since we are about to assess the different factors that are present on a certain area. And in that case, upon assessing those necessities, we are able to identify, or we as a healthcare provider, we are able to identify what are the main needs, or what are the easiest way or transactions in order to provide the community the healthcare service that they need. Third is educating residents on the benefits of preventive care and healthy behaviors to facilitate life changes. And then we also have providing essential services. So providing essential services such as screenings, social support, and counseling. Next, we have helping residents gain access to resources. So helping residents gain access to resources such as affordable medical, dental, and mental health care services, insurance, translation and transportation services, or housing, food, and education. So those are the basic necessities that a community is always required to attain. And for example, we as a healthcare provider or healthcare service provider are always necessary for us to always put in our mind and always consider the geographic location and the situation of our patients. Next, reducing the need for expensive community care. So, in that case, it is always necessary to consider or to reduce the expensive emergency care and hospitalization, since not all the community members or the members in a community are able to afford the financial necessities or the financial urgencies within their hospitalization. And then second to the last, advocating for improved care. Advocating for improved care for at-risk populations to state and federal policymakers, and lastly, working with other community agencies. So working with other community agencies to address the area's mental, physical, cultural, and social characteristics, including nutrition, housing, and transportation. So it is always better to collab with other healthcare providers or community agencies in order for us to better or to carefully select and to carefully assess what are the main factors or the main disparities within the certain community. Okay, so those are the examples of elements of healthcare service. Now let us try to move on to community health goals. So these are the example of community health goals. But first, let us try to identify what is community health goals. The goal of a community health provider is to offer comprehensive services that grant communities direct and immediate access to essential resources, including medical, dental, pharmacy, and mental health care. By educating area residents on what resources are available and giving them the tools to access care, public health workers empower people to take control of their own health. So, community public service or community health service initiative focus on identifying specific geographic areas with high levels of need and helping those communities overcome the barriers to living healthier life. So, since we have the different examples here, the first one is to offer comprehensive service. So, I already mentioned earlier that community health service must be comprehensive and accessible to everyone. Second, focuses on identifying specific geographic areas with high level of need, especially those areas or those rural areas that are not able or being able to reach their town proper that easy or accessibly. Those type of areas are required to be focused on, especially by the government, in order for them to easily acquire the medical necessities that they deserve. And then to form strong bonds with citizens. So those are examples of the main goals of community health service. So before I end my discussion, I would like to include just a short reflection or a short summarization of my topic. So community health service is necessary or is already established by the government in order for the community to have the accessible needs in terms of medical needs, and the urgencies in terms of whenever there are disparities in terms of health. And also, it is necessary for those people or the members of the community to have a free access to medical services without triggering their financial expenses. So, I hope you learned something regarding on my report. That is all for today. Thank you for listening.